Hello everyone, this is Arun from Medcity International Academy. What do you find most difficult in OET writing? Is it about the possible reader to whom you have to write the letter to? Or the kind of letter that you may encounter in the examination? It's been observed that in OET writing, the candidates are demanded to write letters to a variety of healthcare specialists to whom they haven't ever written a letter during their exam preparation. Am I right? In a recent OET examination for nurses, the OET had asked the candidates to write a letter to a music therapist. And you may wonder what data you could add to such a letter. And there comes the element of surprise, and it creates panic. Actually, is there a need to panic? I don't think so. We at Medcity International Academy would like to offer a solution to such dilemmas. Interesting, isn't it? Okay, firstly, you need to understand the type of letter that you are given in the examination. As you are aware that there are three types of letters in OET writing. The first one is referral, the second one is transfer, and the third one is discharge. For referral, you write letters to nurses, doctors, physiotherapists, and sometimes a music therapist. And in transfer, you write letters to a community nurse, a nurse in a nursing home, or a hospital nurse. And the third one, discharge, you write letters to retirement home, nursing home, and so on. By carefully analyzing the writing task, you will get a clear picture about the type of letter that you are asked to prepare. Secondly, from the case note, you should be able to understand who you are and to whom you need to write the letter to. In the question booklet, you will either be provided with a case note or a discharge summary. And you must understand that the case note is not just a collection of some points. It has got a central line story. By scanning the case note, you should be able to understand the storyline through the chain of events that had occurred during the treatment period. Always remember, you are writing this letter for your own patient. And as a nurse, it's your primary duty and responsibility to make sure that your patient receives the utmost care and assistance from the reader's end. Understand the reason why you are writing this letter, and this must be the sole purpose of this letter. Then identify relevant data from the case notes which supports the purpose of this letter, which means the content of the letter should comply with the purpose of this letter. And the best way to do is expand the given points into meaningful sentences. Include only relevant data which must be brought to the reader's attention. Prepare your letter as an effective and well-structured summary of the case note. Effectively divide your letter into paragraphs as introduction, body paragraph, and recommendation paragraph if needed. Once you have completed your letter, make sure you proofread your letter from the reader's point of view. Check whether the recipient is able to gather all necessary information from the letter so that he or she can efficiently perform the requested care or services. So here's a tip for you. When preparing for OET examination, it would be better if you could collect data of job profiles of various healthcare professionals like audiologists, speech therapists, and so on, because all these might come in handy for you. That's it, guys. And remember, it's an age of smart work, not hard work. If you have any queries, reach out to us at Medcity International Academy, Kanjikuzhy, Kottayam.